Okay, management in the public sector. This will be lecture 2. So in South Africa, it consists large section of the public and a smaller but fast-growing private sector is an NGO sector. The public health sector is funded by 40% of all expenditures on health comes from the national treasury. Public health consumes around 11% of the government's total budget and is allocated mostly to 9 provincial departments. Okay, um, this is higher than 5% of the GPT recommendation by the World Health Organization and reflects the majority of the burden, disease management, and treatment carried by the public sector in South Africa. So, the high level of poverty and unemployment in the country means healthcare remains largely the burden of the state, with the National Department of Health holding overall responsibility for healthcare with a specific responsibility for the public sector. Despite for the high expenditure, health outcomes are poor and in comparison with other small middle income countries. Okay, so the Constitution requires 1. The service to be equitable without bias, resource to be utilized efficiently, economically, and effectively, people responsive to people's needs, and the public to participate in the policy making. Um, the public delivery system must also be accountable and transparent and development oriented. Challenges for service delivery: high inequality services, wasteful bureaucratic systems, unresponsive to consumers' needs, citizens are not consulted, and it's not accountable. So, the public service delivery: the high standard of professional ethics must be promoted and maintained. Efficient economic and effective use of resources must be promoted. Public administration must be developed. Service must be provided impartially, fairly, equitably, and without bias. People's needs must be responded to, and the public must be encouraged to participate in the policy making. So here, the public administration must be accountable, must be transparent, and must have accessible and accurate information. Good human resources management and career development practice to maximize human potential. Public administration with employment and personal management practice based on ability, objectively, fairness, and the need to readdress imbalance of the past to achieve the board representation. Batabile's white paper. Batabile simply states the mean of encouraging public servants to be service oriented, to strive for excellence in service delivery, and to commit to continuous service delivery improvement. Transparent mechanisms which allows customers to hold public servants accountable for the type of service they deliver. Introduction of putting people first was introduced in 1997, but really is not a separate and a distinct process. It is and should be a guided principle for all service deliveries. So the principle, the Batabile principle, you got consultation, access, courtesy, standard, service standard, information, openness, transparency, readdress, and value for money. So with consultation, citizens should be consulted about the level and equality of the public services. Access, they must have access to the services provided easily and comfortably. They must be treated with consideration and respect. That's courtesy, and making sure the promised level of the quality of the service is always at the highest possible standard. That is setting the standard. Information, providing them with good information on the service available to them. Okay, openness and transparency, allowing them to ask questions and responding to the inquiries of honesty and frankly. Readdress, if there's something wrong with the standard, the organization and the service delivery party must readdress the issue and evaluate and change. The public sector should be provided economically and efficiently in order to give citizens the best possible value for money. Portability implementations. All national and provincial departments must regularly and systematically consult their customers about the service they're currently providing, the provision on new basic services to those who lack them. 2. Consultation must cover the entire range of existing and potential customers and must include the views of those who has previously been denied access to the public service. 3. The result of the consultation must be reported to the MEC, made to public, and also widely publicized outside the organization. The Patient Right Charter. It is to ensure the realization of the right of access to healthcare services as guaranteed in the Constitution of the Republic of South Africa. The Department of Health proclaims the Patient's Right Charter as a common standard for achieving this realization. Patient's Right Charter, a health and safety environment, participation in decision making, access to healthcare, knowledge to one's health insurance and medical aid schemes, choices of health services, and continuity of care. Confidentiality and privacy, informed consent, refusal of treatment, be referred for a second opinion, continuity of care, complain about health care services. So every patient has the following responsibilities of their own responsibility. So they need to take care of their own health, they need to take care and protect for their own environment, respect for rights of other patients and healthcare providers, to utilize the healthcare system properly and not abuse it, to know his or her local health services and what they offer, to provide the healthcare provider with relevant and accurate information for diagnostic, treatment, rehabilitation, or for counseling purposes, to advise healthcare providers of his or her wish with regards to his or her death, to comply with the prescribed treatment and rehabilitation procedure, to inquire about related cost of treatment and or rehabilitation and to arrange for payment, to take care of health records in his or her position. To promote service delivery, both national and provincial departments are required, among other things, to develop and implement the following steps. Strategic planning as one, integrated human resources plans, financial plans, operational plans, service standards, monitoring and evaluation mechanisms. To simplify the above steps, you want to plan, implement, and monitor, which is similar to the strategic planning mentioned in lecture 1. So here we got the policy of management of hospitals. Okay, strategic management is planned by the Department of Health, overhauling of the healthcare system and improving its management. 10-point plan created in 2011. Okay, so the aim is to ensure that the management of the hospital is underpinned by principles of effectiveness, efficiency, and transparency. The key aspects in developing the policy. So 1, classification of the hospital, appointment of competent and skills manager, minimum requirements for appointment, development for accountability framework. So if we look at the different types of hospital, there are actually 5 classifications of hospitals. 1 is district, 2 is regional, 3 is tertiary, 4 is central, and 5 is specialized. So appointment for competent and skilled managers, job description of a hospital CEO, plan, coordinate and manage healthcare and support services effectively and efficiently as an integral part of health services delivery in the area of service by the hospital. To represent the hospital at provincial and local forums. Minimum requirements for appointment of the hospital CEO. Educational, degree in health-related field, usually requires a degree or diploma in management. Experience, a minimum of 5 years management experience in the health sector. Accountability, the hospital board and subcommittees, documentations and implementations of law. And that is lecture 2.